There are a number of patients who have in the past had a operation called a vertical banded gastroplasty, or stomach stapling was a common name called, that this operation was called. And let me describe it for you. So esophagus coming from your throat, stomach, small intestine. Now in this operation, the stomach was exposed and a stapler was placed through the stomach here, where a hole, where the front wall was stapled up against the back wall and a hole was punched out there so that you could look right through the stomach. And then another stapler was placed from this hole all the way up to this corner and then fired many times, essentially stapling the front wall to the back wall. And then a band was placed through this hole and around here, like this, so that we had a small opening on the inside. And the operation made sense in that we had a small pouch, usually help you take in only small meals, and a small opening so that it emptied slowly. But the real weakness of this operation was this plastic band. It was made of Dacron or Gore-Tex. And if this band was too loose, that this opening was too big, it emptied as fast as the patients ate. And they had very poor weight loss. Now, if the band was too tight and the opening was very small, then the patients could not tolerate heavy or solid foods, and they either continued to try and vomited and vomited and vomited, and eventually this staple line would heal, and now the food went this way and their weight loss stopped. Okay? Now occasionally some patients will have it too tight and have trouble vomiting all solids, and then develop a behavior which we called maladaptive eating, where they switched from healthy foods to milkshakes and ice cream and butter and mashed potatoes and gravy and high-calorie liquids and highly refined carbs that our mouth can turn into water to go through. And actually their weight loss also stopped because of these high-calorie liquids that they were forced to eat. So occasionally the band was just right, and the patient had good weight loss and did well for many years, but I find that that's very uncommon. In fact, it's estimated that at least 40% of the patients had a dehiscence or breakdown of their staple line, and now they have an operation that was supposed to help them control their weight, which is no longer effective. Okay? So these patients come to see us now, and they have redeveloped their severe life-threatening obesity, and they have a previous stomach stapling or vertical banded gastroplasty. And we see these patients, and this is a significant part of my practice now, is patients who have had previous bariatric surgery and are having complications. And we evaluate them by doing contrast x-rays where you drink some stuff, and that can show us what the anatomy looks like, and evaluating them with an upper endoscopy where we look down there with a scope and also give us an idea of what the anatomy is. And then usually we can offer them some help, and the help usually comes in the form of creating a normal gastric bypass. And when we do that, we go in and we make the stomach into a small pouch like this, and I usually take out this part because it tends to cause troubles with nausea. And then we measure down on the intestine and bring this end up like this to here. And we make an opening here, and we make an opening here, and sew those two openings together. And now we have a standard gastric bypass. So this is conversion of a failed vertical banded gastroplasty into a gastric bypass. And this is possible, and it's technically very challenging, certainly has much higher risk of all perioperative complications because of the scar tissue from the previous operations. So it's something that you don't want to go into lightly, but if you are having severe life-threatening obesity or other complications like persistent vomiting or severe gastroesophageal reflux or inability to tolerate normal food after vertical banded gastroplasty done many years ago, if you're fit enough for the rigors of a revisional surgery, meaning that your heart and lungs are in good shape, then we can talk about doing some things to help you get back to where you can eat healthy foods, stop the vomiting, stop the reflux, and get good control of your weight.